State leaders held a news conference today to give the latest on Oklahoma's response to COVID-19. News on 6's Ashlyn Brothers has new details for us this evening. Ashlyn.
Lori, Oklahoma health experts say we are still in a pandemic, and that reflects the state's response. State Commissioner of Health Keith Reed says the Omicron variant is more transmissible, but we're seeing less severe cases and therefore less of a strain on the medical system. Reed says there's more breakthrough cases, about 30%, but of those patients, nearly 80% had not received a booster shot. The health department says the state has seen an increase in hospitalizations overall, but not as significant as surges we've seen in the past, with fewer patients admitted into the ICU. The state is experiencing a shortage of at-home tests, but plenty of tests are available through a provider network.
I think it's also important to point out that the number of cases that we have out there is obviously underrepresented because we do have so many at-home tests. We need to look at hospitalizations as our primary metric of the impact of COVID.
Now, Reed is concerned about the nationwide depleted supply of monoclonal antibody treatments and antiviral pills. He says the state is allocating a small supply to each region to make sure all of Oklahoma has some access to this treatment. The department says it's working with the Biden administration to increase our treatment supply. Health officials are asking folks who are simply seeking a COVID test to please look outside of emergency rooms. Ashlyn Brothers, Oklahoma's Own News on 6.